Hello friends, this is Dr. Balram Sharma. I am an endocrinologist and presently I am working at SMS Medical College in the Department of Endocrinology in the position of Associate Professor of Endocrinology. So I hope that all of you are fine in the time of COVID because we are facing this COVID emergency, and I am sure that all of you, including your family members, are perfectly fine in this epidemic time. Because in our specialty we used to deal with diabetes patient, there are a lot of questions about which type of diet we should use. Again and again we are answering those, and today we are going to discuss with one very relevant topic or questions of the diabetic patient which we used to face. I'm sure that that will be quite useful for you because there might be some near and dear or some relative or some family member of your who is diabetic. So we know that now summers are there, and in summer is synonymous to the relishing fruits, particularly mangoes, because mangoes are quite easily and quality mangoes are available in our country in the summers. We know that. We see that markets are decorated with these juicy delicacies which are quite difficult to resist from all of us, including the diabetic patient. Because most of us want to use fruits, most of us want to consume mangoes. Whosoever is diabetic also, they also try to consume mangoes. They repeatedly request their family members that, okay, let me eat some mangoes. But most of the family member are actually having fears about their impact on blood glucose level. So are they safe? Aren't they safe? How they should consume mangoes? Should they consume? Shouldn't they consume? There are a lot of questions, so we will be going to discuss about these. So first of all, I will be discussing about the benefits of mangoes. What are the benefits? Why we should consume mangoes? Means anybody, including diabetic, why one should use mangoes. So one is definitely the taste. Everybody is aware about it, that this is really a very tasty or tasteful fruit which we can't resist. But there are some nutritional benefits also. We know that whatever seasonal fruit is there, they have actually lot of benefits. The similar is with mango, and we used to claim that mango is the king of all fruits in our country. Mangoes are actually enriched with a lot of essential vitamins and various minerals, so that actually make them good nutrition to any diet. Mangoes contain potassium, mangoes contain lot of fibers, various vitamins are there, and some amount of protein is also there, some iron is also there. So this all contains several minerals, several vitamins. They also contain some magnesium, some calcium, some phosphorus, some zinc and iron. So because of these all, they actually has lot of benefits. Because of this all, they can help in improvement in immunity, because they are actually having benefits of antioxidant properties they have. And ultimately they might be useful in blood pressure control, because we know that whenever somebody is hypertensive, then if you are consuming fruit, particularly those fruits which contain potassium, then they are actually useful in diabetic patient who are hypertensive also. Means in hypertension diet which we used to advise that fruits are good for any hypertensive patient, excluding the kidney patient where the chronic kidney disease is there, because that can actually lead to hyperkalemia or the higher level of potassium. So for those, they might not be useful, but in other all setting, in most of the hypertensive patients, any fruit is good, including the mangoes. So these mango, when we are using, they are actually having antioxidant properties. They may help in blood pressure control, and by that they may help in maintaining healthy heart. As they contain iron and various vitamins, so they may help in anemia also. Because they contain lot of fibers, so they may help in relief from indigestion or acidity or some other GI problems. So there are various benefits. At the same time, we used to see that diabetic patients are actually having a habit of craving for sweets, craving for fruits, because there are some dictators in the family and they used to resist, no, आप ये नहीं खा सकते, आप वो नहीं खा सकते, means all the time they are facing actually a lot of restrictions. So the similar is happening with the fruits also. But we if the family member are aware, we are aware that how beneficial these all fruits are, then we can actually have a better vision or better version that how we can advise to our family members, and by this all we can actually understand that they are useful in diabetic patients also. We know that for diabetic patient we used to advise this food should not be taken, this food is okay, this food is not okay. So what is actually the basis of those all? So the basic is actually there is one scientific formulas known as glycemic index or glycemic load. So there are two formula, one is glycemic index, another is glycemic load, and these formula actually indicate that when you are consuming any food or any fruit or anything which you are consuming, how much amount of glucose is actually entering into your body and how they are actually leading to the increment in blood glucose level. So if any food which is having low glycemic index, then the amount of glucose which is there in that particular food is actually not going to increase blood glucose level significantly. Means if the glycemic index is low, so then that food is okay. We usually divide the glycemic index into three. There is one which is low glycemic index, and most of these food which actually has low glycemic index are okay for any diabetic patient if we are using in moderate amounts. So low glycemic index is the food which has glycemic index less than 55. Then another is the moderate, which is 55 to 70, and the last is the high glycemic index where the glycemic index is more than 70, and they are actually not the right food which the diabetic patient should consume. So if any food is having low glycemic index, then that is okay. Fortunately, as we are talking about mangoes today, so mango have less glycemic index. The glycemic index of mango is 51. In the today's time, anybody in your family can search that what is the glycemic index of that particular food whenever you are going to consume, and if there is any diabetic, they themselves also can search on Google that what is the glycemic index of that particular food, and if the glycemic index is less than 55, then you can consume that food. But you have to consult your doctor, you have to consult your nutritionist or your dietitian to have a better vision about that particular food. So as mango has glycemic index that is less than 55, actually the glycemic index is near 50 of mango, so one can safely use these fruit, but with certain precautions. Means only glycemic index cannot tell everything. Means if you are aware about this glycemic index and you are going to tell that okay, Dr. Balram has said that glycemic index is okay, I can consume in any amount. No, that is not going to happen. So there are some advices which if you are following, then you can safely consume mangoes. So what are those advices? The first is the amount. So if anything, if you are using in moderate amount or moderation or some limitation, then that is not going to harm you in any way, including increment in blood glucose level. So if you are having moderate amount, what is moderate amount? I will be discussing. Then that fruit is okay. The moderate amount is actually dependent upon the carbohydrate content of that particular food. So if the carbohydrate content of any food is below 15 gram per serving, then that is okay, means one can use it. So when you are consuming a mango which is of medium size, small or medium size, means if the weight of the mango is less than 100 gram, then the amount of carbohydrate which is there in that mango is nearly 10 to 15 grams. So if you are using that a small or a medium sized mango, then that is okay. Means one can use or consume that mango in a day even if he is diabetic. The second important point is that if you are going to consume mangoes, then this is better that in comparison to very ripe or soft mangoes, you should use just ripe mangoes or little unripe type of tight sort of mangoes, because the glycemic index is less of those mangoes who are less unripe or means slightly unripe mangoes in comparison to the soft mangoes which are very much ripe mangoes. So the actual key is in the moderation. So if you are using a small mango or half of a big mango, then that is okay. The another point that we know that because this is having some carbohydrate, so whenever you are going for some physical activity, then this is always better that you are consuming mango just before that physical activity. So there will be a check balance between the increment in the blood glucose level and the consumption of the mangoes. So that will actually help in maintenance of blood glucose level. So even those who are diabetic patient, they can use mango, but again we have to follow some recommendation. There are people who like to eat mangoes. There are some people who like to eat or use the mango juices or fruit juices. So this is a clear-cut recommendation that most of the juice are actually having high glycemic index, and the same is correct for mango also. So whenever you are going to consume mangoes or whenever you want to enjoy mango, then you should not try to consume the juice. You should avoid the milkshakes or the mango shakes. That is not good for you, because that will definitely increase your blood glucose level. But you can use mangoes in slice, because the slice contain lot of fibers also, and fiber actually has a check balance on absorption, and there is a slower absorption in your intestine, and the increment in blood glucose level is not that much, which can be there with the fruit juices or the mango juices or mango shakes. The second point, as I just mentioned, that this is always good to eat mangoes just before some physical activity. So these are some important tips which one should be ready to understand when they are going to consume the mangoes. At the same time, if you are going to consume mangoes, then try to reduce other things or other fruits or other diet which actually has high calorie content or high sugar content. Otherwise the blood glucose level might be disturbed. As we just mentioned that the 100 gram or 80 to 100 gram of mango is okay for a diabetic patient, and single serving should never be beyond this. And if you can restrict yourself to one serving, that is okay, but half cup of mango can be taken easily even with a diabetic patient. But there is one more step. Whenever you are going to consume mangoes, then best is to monitor your blood glucose level, and you have to see that how is the response of your body with that particular type of food. So once you have consumed mango, after 1 or 2 hours you should monitor your blood glucose level. If that is okay, then fine, you can consume that much of quantity safely, no problem. But if you are seeing that the blood glucose level is rising even with that small amount which we were just mentioning, like less than 100 gram, then you can curtail it, means you can decrease it further and you can monitor it. The second clue is that you can add these type of fruit with some protein high rich foods. So if you are combining protein with mango, like the fibers there are in the mangoes and they help in lowering the blood glucose level or lowering in the absorption. Similarly, the high protein food can also be beneficial in controlling your blood glucose level when you are consuming mangoes. So if you are adding some protein food with the mangoes, then okay, that is also good for you, and that can actually help in control of blood glucose level. So these are some important tips. The most important part is moderation. Again, in limited amount, in certain amount, as we just mentioned, like 80 grams or 100 gram, not more than 100 gram. Or if we want to learn in the manner of number of mangoes, then one small mango, or half of a big mango, or a medium size of mango, which ideally should not be very much ripe, which ideally should be little unripe sort of, or some type of mangoes one can use, because that can be safely used. But you should be very particular that you should monitor your blood glucose level, and if your blood glucose level is okay, then there is no problem. If your blood glucose level is increasing, then you have to decrease it. If you are consuming other foods, that also you have to take care about. If you are going to eat mangoes, then you have to restrict other things, because ultimately we have to restrict our calorie intake, because whatever calories we are consuming, that will ultimately lead to increase in your weight. And we know that whenever you are gaining weight, the diabetes control is actually deteriorated. And according to your doctor's advice, according to your dietitian's advice, according to your nutritionist advice, one should have a total target of calorie intake in a day, and that should be adjusted. Means once you are eating mangoes, then one should not eat other things. So ultimately you have to maintain a balance. So these are few tips by which safely one can use mango. They can enjoy the taste of mango, because everybody is craving for mangoes, or everybody is craving for any type of relishing thing which is available now, because we are facing corona lockdown, and everybody is having lot of tension of epidemic, lot of tension of disease. There are various limitations because of the lockdown, so everybody wants something which can help to elevate their mood, to elevate their taste. But at the same time, whenever you are purchasing something including mangoes from outside, be very particular about taking precautions, about proper washing of those fruits. You should not consume those fruits on the same day. You should keep them away in a remote place where that is away from your kids' reach, and you should ideally consume them at least 24 hours or more after your purchase from the market. Whenever you are going to market, try to keep maintaining a social distance of at least 1 or 2 meter. 2 meter is better, safe. You should wear a mask. Whenever you are bringing it back, then you should wash these fruits properly with ideally hot water, and then keep them away from the reach of the kids, and at least after 24 hours one should use it, after proper washing. So these are some tips. I'm sure that all of you is now enriched with the information about the COVID precautions from the WhatsApp University and other sources of media. But I'm sure that this discussion might be useful to you, to your friends. If you have some question, you can post in the message box, and I will happy to answer those. So what is take home message of today? This is quite obvious that every diabetic is concerned about their diabetic status. Everybody who is diabetic is concerned about eating the things or fruits or other food items which I should eat, which I shouldn't use. At the same time, they have some craving for fruits, they have some craving for sweets, they have some craving for various type of food which we use to restrict to them. So if we are using these type of fruit like mangoes in moderation, as we have just mentioned, then that will satisfy their craving also, that will satisfy their wishes also. They will feel little better, their mood will be little better, they will not feel that restricted. मीन्स ओ मेरे को तो कुछ खाने को नहीं देते, सारे टाइम बस ये मत खाओ ये मत खाओ, इस टाइप से मेरे ऊपर हमेशा रेस्ट्रिक्शंस रहते हैं. एंड आई हैव सीन लॉट ऑफ पेशेंट्स who actually try to make a chance that when I can eat some sweet, or when I can eat a sugar, some sugar, when other family members are not there in the family. So means a type of stealing the things in the absence of other family member is happening there, and that is because of various restrictions. So that is a type of some anxiety. So we can actually handle it in a better way. Their mood will be better if we are allowing them to eat, but we should allow with these limitation, with these advice, with these moderations. Then only the things will be useful. So the main thing is not about total restriction. The thing is about the moderation, like we are doing in the corona time, like we are doing in these days of corona epidemic. Thank you, friends. Thanks a lot for listening to me. Thanks a lot.